cause pain, redness, swelling, shortness of breath, and even death. According to an article written by Patricia Emanuel, an occupational health nurse, approximately 300,000 Americans die yearly related to complications from deep vein thrombosis, or DVT. My name is Toni Edelman, and I've been a med-surg nurse for the past 14 years. In order to prevent deep vein thrombosis, it is important to understand what it is, how it develops, and how to avoid it. According to Tabor's online medical dictionary, thrombosis is defined as the formation or presence of a blood clot within the vascular system. You can see the picture here from eMedicine Health. It shows a blood clot that is formed in the lower leg. Although any deep vein in the body may be affected, most blood clots form in the deep veins of the lower legs, with the most common being in the calf of the leg. You can see here how it's swollen and red, and it's affected the circulation in the foot. Another area that can be affected is above the knee, or the iliofemoral area. Since it forms so high in the leg here, you see the whole extremity is affected. Upper extremity DVT can occur, but it's less common and usually has to be precipitated by an invasive procedure such as central venous catheter placement. Pulmonary embolism is the most severe complication of a DVT. This is when a clot or part of a clot breaks off and occludes the flow of blood to the lungs. If flow is completely blocked, as it is here in this picture, it can cause cell damage and possible death to the patient. Now that we know a little about what a DVT is, let's talk about how it develops. So how do I get a DVT? There are several possible causes. I'm going to list a few. Trauma from say a motor vehicle accident or a fall, or basically anything that can cause broken bones or prolonged bed rest, immobility. Say you broke your leg and you had to be in bed with traction. Surgery is another example, abdominal surgeries and orthopedic surgeries. As an orthopedic nurse, we see lots of hip and knee surgeries that are at severe risk for DVT, and we usually use precautions for that. Then there's hormone treatment or hormone replacement therapy, oral contraceptives. I'm sure you've seen there's all kinds of commercials out there trying to get you to sue for taking this medication or that medication because it's caused a stroke or a heart attack, and there's many risks associated with that. Some patients are more susceptible than others to getting a DVT. Sedentary office workers is one example because they sit in a cubicle all day and don't get up. Then there's truck drivers and air travelers who may have prolonged immobility due to deadlines they're trying to reach, and IV drug users that have repeated trauma to the vein. Since we've learned who's at risk, let's move on now to detect symptoms. So, how would you know you have a DVT? As the clot blocks the circulation, it can cause warmth, pain, redness, or swelling, and you may have possibly minimal or no symptoms at all. Your physician may order certain diagnostic tests, such that they may do a physical assessment to assess for a positive Holman sign, which is pain in the calf when the foot is passively dorsiflexed. They may also draw some lab work, such as a D-dimer, which is mostly helpful in determining a negative diagnosis. Because if you get a positive diagnosis, that just kind of basically lets them know that diagnostic imaging is required, and they usually do an ultrasound for that, which is a method of choice. Now that symptoms are covered, we can discuss how to avoid getting a DVT. There are several preventive measures you can try. If walking is totally impossible, you can wiggle your toes or move your ankle in a circular motion, or flex the foot. If you're an office worker, just standing up is better than nothing. They may also do prophylactic therapy, such as anticoagulants or antiplatelets, such as Coumadin or heparin. They may have you wear compression stockings to improve circulation. Or just remember that early ambulation is the key after any immobilizing event to prevent deep vein thrombosis. So in this speech, I have discussed how to prevent deep vein thrombosis by understanding what it is, how it develops, and how to avoid it. Because DVT can occur without warning, prevention is the best plan of action. So if you think you might have the symptoms of a DVT, talk to your doctor or healthcare professional immediately. Thank you.